Welcome to MBBS Online Lecture 2021. The topic for today's lecture, we are going to start muscles of the lower limb. So first of all, when looking at the posterior side of the body, we have two regions. First of all, the gluteal region that is marked by the hip bone. The muscles that are present in the hip bone, these are called gluteal region muscles, or the whole region is called gluteal region. Now, what are the muscles that it has first of all the gluteus maximus, gluteus medius, gluteus minimus, and tensor fascial lata. So we are going to discuss its origin, insertion, plus innervation and blood supply with its action. So let's start. So looking at the gluteus maximus, it is originating from the lateral posterior surface of the sacrum,
Coccyx.
gluteal surface of ilium, behind the posterior gluteal line. So in the region of the hip bones, we have seen there are three lines: anterior gluteal line, inferior gluteal line, and posterior gluteal line. So the gluteus maximus rising from the behind the posterior gluteal line. So there is a thoracolumbar fascia and sacrotuberous ligament, which has the origin of the gluteus maximus. It is inserted in the iliotibial tract and gluteal tuberosity of femur. We'll see in a minute of the gluteus maximus. Innervation is innervated by the inferior gluteal nerves that are arising from the spinal cord L5 to S2. The function of the gluteus maximus is particularly in the hip joint, that is thigh extension, thigh external rotation, or we say lateral rotation, thigh abduction, thigh adduction. Inferior part does adduction. So we'll see gluteus maximus in this picture. In the first one, we have the gluteus maximus. We can see it is arising from the posterior gluteal line, from the iliac crest, and it is attaching. It has two attachments. First of all, the gluteal tuberosity on the lateral aspect of the femur, plus the iliotibial tract has also attachment to the gluteal maximus. So now come to the gluteus medius. It is arising from gluteal surface of ilium, also between anterior and posterior gluteal lines. And inner insertion is lateral aspect of greater trochanter of femur. So it is attaching or inserted to the greater trochanter of femur. Innervation is innervated by in superior gluteal nerve. So all of the gluteal muscles that are present in the gluteal region are innervated by the superior gluteal nerve, except the gluteus maximus, which is innervated by inferior gluteal nerve. So the function of the gluteus medius is the thigh abduction, thigh internal rotation, that is the anterior part, or we say thigh medial rotation, pelvis stabilization. So gluteus minimus and gluteus medius has also the same innervation, plus they have the same action but different attachment. Gluteus minimus is arising from the gluteal surface of ilium between anterior and inferior gluteal lines. It is inserted to anterior aspect of greater trochanter of the femur, while the gluteus medius attaching lateral aspect of greater trochanter. We'll see in a minute. So this is the gluteus medius. It is arising from the between the posterior and anterior gluteal line, attaching to the greater trochanter of the femur, while the gluteus minimus is also arising from the inferior gluteal line and attaching to the posterior aspect of the femur on the greater trochanter. So there is a last one. There is a tensor fascial lata, which is arising from the anterior superior iliac spine, outer lip of the iliac crest. It is inserted or continuous with the iliotibial tract. Iliotibial tract is also the fibrous tissue or fibrous muscular tissue which give insertion to the gluteus maximus. So the function of the tensor fascial lata is about the hip joint, which is thigh internal rotation, that is thigh medial rotation, weak abduction at the knee joint, since it's also attaching crossing the knee joint, so it also functions related to the knee joint. So there is a leg external rotation, weak leg flexion and extension stabilizes hip and knee joint. So this is the from the outer aspect of the iliac crest. It is arising the tensor fascial lateral, and in the middle of the femur it is continuous with the iliotibial tract, which attaches to the lateral side of the tibia and fibula. So give as a function in external rotation and flexion at the knee joint as well as the hip joint. Now come to the inner hip muscles. So there are also small muscles that are present in the hip region apart from the gluteal region or gluteal muscles. So what are these? First of all, the first one is the iliacus, second psoas major, psoas minor, obturator externus, obturator internus, superior gemellus, inferior gemellus, piriformis, and quadratus femoris. Now the obturator internus and superior gemellus, or as well as inferior gemellus, are also collectively called triceps coxae. Now we'll see the origin and insertion for these muscles. So first of all, the iliacus, it is arising, since its name indicates the iliacus, it is arising from the iliac fossa. Insertion is the lesser trochanter of the femur. So we have seen that the femur, on the head of the femur, around head of the femur, there are the two trochanters. First one is the greater trochanter, while other one is the lesser trochanter. So iliacus attaches to the lesser trochanter of femur. Innervation is innervated by femoral nerve. Since iliacus also lies in the anterior aspect, somewhat anterior aspect in the thigh region, so it is innervated by femoral nerve. While the function for this muscle is the thigh trunk flexion, thigh external rotation, trunk lateral flexion, psoas major and minor also lateral flexion. Psoas major, it is arising from the vertebral bodies T12 to L4, as well as intervertebral disc between T12 to L4, postal processes. So insertion is in the lesser trochanter of femur. So iliacus and the psoas major both attached to the lesser trochanter of femur. Innervation is the anterior rami of spinal nerve, since these are arising from directly from the spinal cord or the vertebral body. They can be innervated by the spinal nerve. So functions are we have discussed. Psoas minor as well as arising from the vertebral bodies of T12, L1 and vertebra. Attached to the insertion is in the iliopubic eminence, bacterial line of pubis. Obturator externus, anterior surface of the obturator membrane, bony boundaries of the obturator foramen. So obturator externus, we have seen in the hip bone there is a canal, we say a body that is forming a canal, such as this one. This one is called obturator foramen. So the obturator externus is basically arising from this foramen and attached to the greater trochanter of the femur. That's why it's called obturator externus. So trochanteric fossa of the femur and innervated by obturator nerve. So obturator nerves are also passes through that obturator foramen, innervating this muscle. As well as there are other inner hip muscles. These are obturator internus, which is arising from the ischiopubic ramus, posterior surface of the obturator membrane. Insertion is the medial surface of greater trochanter of femur. Innervation is nerve to the obturator internus. So there is a separate nerve for the obturator internus as well as the superior gemellus. Functions for these muscles are thigh external rotation, lateral rotation, thigh abduction, and stabilizes head of the femur in acetabular tubulum. So superior gemellus also arising from the ischial spine, while the inferior gemellus is arising from the ischial tuberosity. Insertion is the medial surface of greater trochanter of the femur. So we will remember that these are attaching to or inserted to the greater trochanter of the femur. So nerve to quadratus femoris also innervates superior gemella and inferior gemella. Piriformis is another muscle that is arising from the anterior surface of the sacrum between S2 and S4. Has a origin from the gluteal surface of ilium. Attachment is on the apex of greater trochanter. So these all muscles are attaching towards the greater trochanter. So this will be easy in remembering their origin and insertion. So innervation is from the nerve to piriformis. There is a separate nerve there is a spinal nerve of S1 and S2 segments. Now there is a last muscle that is a quadratus femoris. It has a shape of a quadrangle. It has quadrangular shape. That's why it is called quadratus femoris. It is arising from the ischial tuberosity of the ischial bone and attaching to the intertrochanteric crest of the femur between the trochanter, greater trochanter and lesser trochanter. There is an intertrochanteric crest where it is attached. So there is a separate nerve for this also arising from the L4 and S1, that is nerve to quadratus femoris. So function for this muscle is at the hip joint. It stabilizes the head in the acetabulum and also thigh external rotation. So we'll see these muscles in a picture. So first of all, you can see here, this is the iliacus arising from the external surface or say iliac fossa and attached to the lesser trochanter of the femur. Now there is psoas major arising from the vertebral bodies as well as their spinal processes attached to the lesser trochanter of the femur. There is a psoas minor arising from two vertebral bodies attached to the pubic bone. So obturator externus arising from also obturator foramen that we have discussed attached to the lesser trochanter of femur. It has a function in stabilizing the hip joint. So this one is these two muscles are obturator internus and superior gemellus. Upper one is the below one is the obturator internus and superior one is the superior gemellus. You can see here that it's the obturator internus is rising from the obturator foramen attached to the greater trochanter. Both has an attachment towards the greater trochanter. So iliacus, psoas major and psoas minor has attachment towards the lesser trochanter, while obturator and also obturator externus. And obturator internus and superior gemellus has attachment towards the greater trochanter as well as inferior gemellus has attachment towards the greater trochanter. So as you can see here, it is arising from the ischial bone, that is the superior rami of the ischial bone, and attached to the greater trochanter, this is the inferior gemellus. Now the piriformis arising from the vertebral bodies, crossing the greater sciatic notch and attached to the greater trochanter. This is we have discussed quadratus femoris, has a quadrangular shape and arising from ischial tuberosity attached to the intertrochanteric fossa. So these were the inferior, or we say interior thigh muscle or interior hip muscles. Now we'll discuss anterior thigh muscles. So we'll be discussing sartorius, rectus femoris, vastus intermedius, vastus lateralis, and vastus medialis. As you can see here in this picture, this is the anterior aspect of thigh, and I have also highlighted the muscles that we are going to discuss. So rectus femoris with vastus intermedius, vastus lateralis, and vastus medialis, also called quadriceps femoris. Now the sartorius is arising from the anterior superior iliac spine, inserted into the proximal end of the tibia below medial condyle, proximal end of tibia. Innervation is all, so anterior muscles, must remember that all the anterior muscles are innervated by femoral nerve. So function is the hip joint thigh flexion, thigh abduction. Since it's crossing obliquely the anterior thigh, so it has also abduction while external rotation is also there, and has also function in the knee joint such as leg flexion and leg internal rotation. Now the rectus femoris, part of the quadriceps femoris. First of all, and so most anterior, most medial part of the quadriceps femoris, anterior, arising from anterior inferior iliac spine and inserted into tibial tuberosity via patellar ligament. So the tendons of the rectus femoris forms the patellar ligament and also attached anteriorly to the tibia where it has a tibial tuberosity. Innervation is I have discussed. So action for this muscle is the hip joint. At the hip joint, these are the thigh flexion, knee joint. At the knee joint, there is a leg extension. So rectus femoris does thigh flexion at the hip joint, while at the knee joint it does leg extension. Now the vastus intermedius, this is the deep muscle of the anterior aspect of thigh. It is rising from anterior surface of the femoral shaft. Now has attachment towards the tibial tuberosity, because these quadriceps femoris are also we called bundle muscles. These are attached towards the single tendon. They form a single tendon attached towards the tibial tuberosity via patellar ligament. So their insertion is very easy to remember. So innervation is also this one, and all the anterior muscles of the thigh has a function in thigh extension at the hip joint, while thigh flexion at the hip joint, while knee extension at the knee joint. So vastus lateralis also rising from linea aspera of femur, greater trochanter of femur. Attachment tibial tuberosity I've discussed. Vastus medialis, intertrochanteric line, spiral line, linea aspera, medial supercondyle line of femur has a role in leg extension. So these are the muscles we are going to see. First one is the sartorius. You can see it's arising from the anterior superior iliac spine, crossing obliquely towards the medial side and attached to the medial aspect of a tibia, medial, or we say medial condyle of the tibia. So it has a function in, if it contracts, it moves the leg to laterally. So it has also, it does flexion as well as the external rotation. Now the rectus femoris, most anterior muscle arising from the inferior anterior iliac spine, forms a patellar ligament where it attaches to the tibial tuberosity. So these muscles are also all attached to the tibial tuberosity. So this is the vastus lateralis, this is the vastus intermedialis, and this is the vastus medialis. It is on the lateral side, that's why it's called lateralis. It is between these two muscles, vastus lateralis, medialis, that's why it's called intermedialis, while the vastus medialis is on the medial side of the body. So now we have completed anterior aspect of thigh. Now we are going to move towards the posterior thigh. As you can see in this picture, we are going to discuss three muscles in this region. These are semimembranosus, semitendinosus, biceps femoris. Must remember that the posterior thigh muscles has a function in hip joint extension, while knee joint flexion. So opposite of the anterior thigh muscles. Now the semimembranosus origin, it is supralateral impression on the ischial tuberosity arising from ischial tuberosity. So all the muscles of the posterior thigh, most of the time arising from the ischial tuberosity. Attachment is the medial condyle of tibia. Innervation is by tibial division of sciatic nerve, and all the muscles of the posterior thigh are innervated by sciatic nerve. So function is in the at the hip joint, thigh extension, thigh internal rotation. At the knee joint, it's leg flexion, as I have discussed, and internal rotation also. Semitendinosus, it's called semitendinosus because it's half muscle and half body is the tendon part. So it's arising from posterior, also from the ischial tuberosity, are attaching towards the proximal end of tibia below medial condyle via pes anserinus. So pes anserinus is basically the flap of tendons formed by the three muscles. These are the sartorius, This is found on the medial side of the leg or medial side of the tibia. The muscles involved in forming this type of tendon are tendinosus, sartorius, and gracilis. Now the innervation is also sciatic nerve and function are the same. Now the biceps femoris. It has two heads. First one is the long head and the short head. Long head is the arising from ischial tuberosity, while short head linea aspera of femur. So the long head crosses two joints at a time. First one is the hip joint and other one is the knee joint, while the short head does only crosses one joint, that is the knee joint. It's not arising from the linea aspera, that's why. So the insertion is in the head of the fibula. Now the long head is a tibial division of sciatic nerve, while short head common fibular division of sciatic nerve. Also, we'll remember the common nerve, that is a sciatic nerve. Now the hip joint has a at the hip joint it does thigh extension, thigh external rotation, while at the knee joint leg flexion, opposite of the anterior muscles of thigh. So we'll see in these pictures clearly it's arising from the ischial tuberosity. This is a semimembranosus attached towards the medial side of the tibia. It has also function in the medial rotation as well as extension of the thigh. So semitendinosus also arising from the ischial tuberosity attached towards the medial side of the tibia via pes and serenus, as I have discussed. Now the bicep femoris long head, it's also arising from the ischial tuberosity. So remember the common origin of the posterior thigh muscles. These are the ischial tuberosity. Attached towards the lateral side of the tibia or the bicep lateral condyle of the femur. Now there is a short head of the bicep that is arising from the linea aspera of the femur. It has an attachment towards the head of the fibula. Since we have discussed the posterior thigh, now we are going to move towards the medial thigh because there are three regions in the thigh. First one is we have discussed anterior region, another one is the posterior region, third one is the medial region. So we are going to discuss medial region. So muscles found in the medial region are the pectineus, adductor magnus, adductor minimus, adductor longus, adductor brevis, and gracilis. So the medial thigh muscles are all are most of the time are adductors. So they cause adduction. So their main function is the adduction of the thigh. We'll discuss each and every muscle in detail. First one is the pectineus, arising from the superior pubic ramus. Insertion is the pectineal line of femur, line of aspera also. Or innervation is from, it has two innervations, femoral nerve as well as the obturator nerve, which is coming from the obturator foramen. Functions for the pectineus is the thigh flexion, thigh adduction, thigh external rotation, thigh internal rotation, pelvis stabilization. Adductor magnus, it has two parts, adductor part and the ischiocondylar part. Adductor part is arising from the inferior pubic ramus and ischial ramus, while the ischiocondylar part is ischial tuberosity. So the adductor magnus has two attachments since it has two heads. Adductor part attached to the gluteal tuberosity or line of aspera of the femur, while the ischiocondylar part attached to the adductor tubercle of femur. It's also a dual nerve supply. It has a nerve supply from the sciatic nerve as well as the obturator nerve. So function for the adductor magnus is first one is the adductor, since it's the adductor, thigh adduction, thigh external rotation, thigh extension, thigh internal rotation. Now the adductor minimus, it is arising from the inferior pubic ramus, attachment towards the gluteal tuberosity of femur, nerve supply from the obturator nerve. It has a function in hip joint, thigh adduction, thigh external rotation. Now there is the adductor longus, which is the arising from anterior body of pubis, Attachment towards the line of aspera femur as a nerve supply from the obturator nerve. Function is the thigh flexion as well as adduction mainly, thigh external rotation, pelvis stabilization. So we are seeing that the medial thigh muscles are all are adductor as well as thigh external rotators. So these are the two main functions of the medial thigh muscles. So there is a adductor brevis arising from the pubis body and attachment towards the line of aspera. Nerve supply from the obturator nerve. These muscles, adductor minimus, longus, adductor brevis, and gracilis, are all present in the medial side, and there is a medial side in the medial side of a thigh. Most of the muscles are get innervation from the obturator nerve. So in the anterior thigh there is a femoral nerve. In the posterior thigh there is the sciatic nerve, and in the medial side there is the obturator nerve. So adductor brevis has a thigh action in the hip joint, that is thigh flexion, thigh adduction, thigh external rotation, pelvis stabilization. Now there is a gracilis, that is last muscle. It's also one of the longest of the muscles in the thigh region. It is arising from anterior body of pubic inferior ramus. Has attachment toward the medial surface of proximal tibia via pes and sinus, as we have discussed. There in forming the pes and sinus, there are three muscles, namely gracilis, semitendinosus, and our sartorius. Innervation from the obturator nerve. Now that we have seen that these muscles has the action that are adduction as well as external rotation, but the gracilis is also crossing two joints, so it has also leg flexion and leg internal rotation as well as thigh extension. Now we are seeing in these pictures, first one is the adductor longus. You can see arising from the inferior ramus of a pubic bone attached to the linea aspera. Now there is adductor magnus. You can see it has two attachments, two insertions. First one is the linea aspera. Second one is the whole of the pubic ischial tuberosity with its ramus. So adductor magnus has also important clinical, or we say it is also significant because it is forming in the distal end. It's forming. It says it attached to the first one to the linea aspera and then to the medial condyle of the femur. It's forming a channel that we call adductor hiatus. From adductor hiatus, the femoral nerve, femoral artery, femoral vein crosses from the anterior part towards the posterior part, which is and become popliteal vein and popliteal arteries. From the adductor hiatus, femoral artery and femoral vein passes towards the posterior thigh and becomes popliteal vein and popliteal artery. So adductor brevis, it's a short muscle, has a origin from the inferior pubic ramus. There is a gracilis, it's also longest muscle, inferior ramus of the pubic bone attached towards the medial side of the tibia by a pes and sinus. It's forming pes and sinus here. Now there is a pectineus attached so it has origin from the superior ramus of the pubic bone and attachment towards the linea aspera present in the femur. Now we have completed our lecture. We have completed the anterior compartment, the muscles of the medial compartment, and the muscles of the posterior compartment of thigh. We have completed the gluteal region with the inner hip muscles also. Now in front of you there is a picture and the diagram. So you need to identify the muscles that are present in the anterior compartment of thigh. These are marked as number 1, A, B, C, D, and E. I'm sure you have guessed it right. First one is the vastus intermedialis. C is the vastus lateralis. Sartorius, B is the sartorius. D is the rectus femoris, and E is the vastus medialis. Now, thank you for watching. If you like this video, share and subscribe the channel. Let your colleague know about this channel and also this interesting video and the YouTube lectures. We have also been working on our website, that is www.mbbsonlinelecture.weebly.com. If you have any query, you can email us at examsonline2021@gmail.com. We have also created our Facebook page, so make sure you like and follow us on Facebook page. Make sure you visit this website so you can get ton of video lectures that are from Premium, Osmosis, KENHUB, LECTURIO. Now again, thank you for watching. We'll see you next video.